Welcome to Healthcare du Jour, where we dish up and digest the latest in healthcare. For the next 30 minutes, sit back as we bring you insight, commentary, and discussion on trending topics to the table, all expertly served up by our host and his guests. Healthcare du Jour is brought to you by Healthcare Now Radio, part of the Media Answers Network, and is sponsored by the law offices of Myrick O'Connell. Now here's your host, Matt Fisher.
Welcome back, and thank you for joining as we dive into the hottest topics in healthcare. I'm your host, Matt Fisher. On the menu today is Julie Gerdeman, CEO at HealthPay24. Welcome, Julie.
Thanks, Matt. Great to be here.
So, Julie, what I always like to do before getting into the main part of my conversation is to let my guests give a little bit more of a complete introduction in terms of who they are and what they do. So the floor is yours.
Oh, thank you. I'm the CEO of HealthPay24, and HealthPay24 is a cloud platform that streamlines, accelerates, and really increases revenue collections for providers. And that's hospitals as well as physician groups. And we do that in a couple of ways. We make it very simple and easy for patients to pay their bills from any device, from anywhere. We also do that by offering them options. So the software allows providers to configure discounts and payment plans, even loans. And then finally, we integrate data. So we have a 20-year history of ingesting complex data sources and then reconciling them back to the various backend systems at the providers. So really, we work with hundreds of hospitals, thousands of facilities around the country for over 20 years. And really, it's a privilege to be working in healthcare.
So what first got you into the healthcare industry?
Such a great question. So I've been in this role a little over 2 years, and it was intentional. I come from a healthcare family, so I'm one of 9 children and the third oldest of 9. And my father was a small town family practitioner. I mean, really old school. The phone would ring, the landline would ring in our house, which was forwarded from his office at any hour, day and night. He'd grab his bag and go running out of the house. And I have these very clear memories of that as a child. And I always thought, I just want to be part of that. Like, I want to be part of the healthcare industry and that trust and bond between providers and patients. So it was ingrained in me very early. And I also happen to have siblings that work in healthcare. So for me, with 20 years of payments experience and technology experience, being able to bring that now into the healthcare vertical, the healthcare industry, it's very meaningful and very rewarding.
So also coming from a healthcare family, my dad is also a physician. Was there any pressure or then resulting disappointment that you didn't go into actually becoming a physician?
What a great question. I think because there were 9 of us, he pretty much knew someone would. So there wasn't too much pressure for that. And I was studied liberal arts, and really for me, it was never an interest to be a provider, a practitioner. But several of the 9 are. So yeah, it's a kind of a good mix. But now I get to talk about the technology and operational side of things, which makes for very interesting holiday discussions, as you can imagine.
Yes, no, being on, as you said, on the technology and operational side, I imagine you end up with kind of more insight into what goes into the actual kind of day-to-day detail of how healthcare or how the healthcare system itself interacts with individuals, whereas kind of the physicians and the clinicians rightly get focus on their interaction with the patient when they're with them, but aren't always necessarily fully informed of all the background processes.
That's so true. It really, and I have such an appreciation now in this role. So when we have those conversations, because the doctors and PAs and nurses, all the practitioners, they're trained to focus on that care, right? On the care they're providing and healing and the procedures. And so all the things that support that to make that happen successful, they're not as focused on in their training, right? They don't think about a revenue cycle. They don't think about, the technology. So as they, go into practice, these things then come up. So I totally agree that it's something that they learn later when they're in practice and how it impacts And I think now more than ever, they're more aware, right, as things have evolved in EMR and in telemedicine, right, with everything we're living through. So definitely, yes.
Yeah, and kind of thinking about the evolution that you just mentioned, and certainly kind of the extremely quick evolution through the course of the COVID pandemic this year, how have you seen the processes change over the length of the time you've been working in your position? Because I know you're mentioning that you have been focused on your aspect for 20 years. So I imagine you've seen a lot. Hopefully, you've seen a lot of change in that time.
Yes. Yeah. So it's interesting. So HealthPay's, been around for 20 years, but years of digital transformation happened in a matter of months, right? I think we all saw just a huge compression of things that were just ideas or concepts or, something that a hospital was thinking about doing, but, hadn't budgeted for. All of that got compressed and just it had to happen given the circumstances of the pandemic. So what we've seen as just, what's inspiring is the global evolution as well as local. So I say global in that, to solve for this challenge that we're living through, it's incredible to watch countries and companies, right? They don't consider boundaries right now. In terms of learnings and sharings for a vaccine, for example, right? So that global collaboration, so inspiring. Locally, what we see is the practices and the facilities just, obviously very quickly embracing telehealth, that they just had to, and they adapted. One of our providers told us it's a hospital, very large one that went from a handful of physician groups using it to thousands and thousands, right? In a matter of weeks. That they were able to deploy it. So that's, phenomenal on the clinical side. On the digital side for IT and revenue cycle, we've seen a complete shift to things like curbside, right? So your car becomes your waiting room. Many of our providers have said, hey, our patients are waiting in their car and they're going right to, curb to dock, right to the exam room, right? And that, and then contactless payments. So there's this combination of how can we push a text and get someone to pay their copay while they're waiting in their car, which is, functionality that we had in the roadmap, but quickly deployed, to meet the needs of our clients. How can we get our employees securely working from home, right? Because now they're collecting, but they might be in their home office doing that instead of a central business office because of COVID. And then how can we collect without actual plastic or checks or paper, anything, right? Cash or check, it just all contactless. So these are some of the changes that happened so quickly. They're still underway, but it was really phenomenal to see how fast they were embraced in this short period of time.
Yeah, and you really just described a lot of different aspects. So what are some of the systemic challenges that you were observing that had to be overcome to enable all those different new functionalities to be built in?
Yeah, it was comes down to the people, process, and technology, and we saw it on all three of those fronts. Just hospitals and providers sent all of their support staff home, right? So anyone involved in the technology or in revenue collection, they were all working from home, and that's a shift, right? Rather than them working, collecting from the office. So the people side of it, the process, things are obviously very different when you're talking to patients and you're doing it from your home. And what does that process look like? And how does that need to change? Whether there are procedures. Some of the larger customers that we have had like emergency procedures that they deployed, right? And they said, this is now an emergency. But others didn't. Others were not as prepared as that. So they had to quickly come up with the procedures. And then on the tech front, imagine taking a credit card payment from your house, from your corporate laptop. You need to, if they didn't grab a credit card device on their way out, which by the way, many of them did, but finding secure and providing our clients with a very, compliant way to collect and keeping PHI safe and everything that comes with that, right? So we just saw all of these systemic things brought to the forefront as soon as it happened, because it all just happened so quickly.
Yeah, and it's actually kind of surprising to hear that you said that, using the example of the credit card processor, that you might not have thought to have brought it, but, so it's good to hear, as you mentioned, that in a number of instances that did occur. Because I think that kind of helps to dispel what's kind of a common statement that, healthcare just doesn't care about these things and it wants to operate how it has always operated. But it seems like once you actually drill down and start talking to the folks who are directly involved in it, they are trying to make changes and they are making improvements. Oh
my goodness. I am in complete awe and admiration of our clients because they really are. I mean, I think healthcare has this reputation of you're going back in time, right? When you step into any kind of process in a healthcare facility. But that was not the case through this. There was such a willingness, lots of questions, in immediate, things were addressed immediately. This sense of urgency was there to really ensure that patients could still be seen, pay their bills, feel safe, get their questions answered, that clarity, the relief of stress, right? Because so much when you think about it, there's stress involved in all of this, from wellness all the way through all the other challenges that you have in your life through healthcare. But from what we saw, our most attended educational events, like webinars that we host and things, were about, how can I securely process from home? How can I make my patients feel less stress? Because everyone's under so much stress at this time. These were the questions we were answering and addressing with all of our clients. So absolutely, I can tell you that we were thrilled and just actually just honored to be supporting them through this, right? Because they're there supporting the frontline workers at their hospital. And we have many clients that were in those hotspots in Seattle, in New York, like very early on. So they just wanted to ensure their frontline workers were able to do everything they had to do, and make sure that these back end processes were taken care of.
Yeah, no, as you said, that it is very inspiring, and it ends up being a common theme throughout healthcare. Is kind of my feeling that, and I think this has also been a through point through a lot of the conversations that I've had with guests, which is people who get into healthcare find it to be very much a passion-driven industry, and one where there's a lot of deep-seated personal connection to it.
I totally agree. I think you mentioned your background and mine. Everyone I've met in this role is driven by a sense of purpose. I mean, really, purpose and passion for what they do. And it's not just folks who are treating the patients, right? It's every other role. And we work with IT, we work with the finance team, we work with the digital patient experience teams, in those hospitals that have them. We touch every aspect. We'll touch marketing if they wanted to do something different around communication of bill presentment. So it's really amazing to be working in this industry. I will say even more so now because the changes are being embraced. What I think needs to happen though, Matt, is I think the innovation and the planning for that could probably, as we look forward, be improved. Meaning, instead of looking at technology as like, okay, we're going to do this one big thing, and then we're going to let it sit there for 10 years, right? I think what this has taught all of us is that innovation's constant. It's now being much more embraced as things change quickly in healthcare. So let's change how we plan. Let's change how we invest and budget to ensure that innovation is always top of mind.
And I think that's a great point. I want to dive into that more. But for those of you just joining, I'm talking with Julie Gerdeman from HealthPay24, and we've been talking about the expansion of technology and the improvement of different operational processes within healthcare. And Julie, but as you just mentioned, it's in talking about innovation and wanting to hopefully see a better strategy and kind of approach to it. That honestly is kind of, I think, what ended up having us get connected, because I think we had I saw a comment from you about that kind of aspect on Twitter. So would like to have you unpack that a little bit more and get your kind of detailed viewpoints around it.
Yeah, no, I appreciate it. And I appreciated your comments. I feel that there is an opportunity to continue this trend of innovation. As I mentioned earlier, we've really accelerated digital transformation in these last months due to COVID. What I think there's a big opportunity on is interoperability. We are starting to see the beginnings of interoperability and that being embraced. But that's where I feel like other industries have just really embraced it, and the APIs and having an ecosystem and different players in that really is a big opportunity that I'm starting, we're starting to see, recent announcements, I believe, from Cerner on interoperability, but there's a ways to go in my mind, having come from other industries where I see how critical a strong ecosystem is.
Do you see kind of the regulatory scheme possibly as one of the inhibitors to kind of that vibrant ecosystem?
I do. But here's what I'll say. I think healthcare is personal, right? And that's why we have HIPAA. That's why we as a country, as a people, as a community, respect how personal healthcare is and how important, the protection of our personal data is. So that goes without saying. But where there's an opportunity is to really innovate within that framework of privacy. So while we maintain those guardrails of privacy and data protection, there's still an opportunity to innovate. Let's use COVID as an example. I mean, de-identified data being shared between different pharmaceutical companies in the creation of vaccines, right? In this race to get us a vaccine and then these therapeutics. So there are examples where the sharing of data becomes so important. And I just believe that it shouldn't always just take an emergency or a pandemic. There's an opportunity to innovate within that framework. Take GDPR in Europe, right? The data privacy, everyone thought that was going to be the death knell for tech companies in Europe. And it's not, it hasn't been. So there are examples of how, globally as well as in the US, we just need to be, continue this trend of innovation, but still respecting the privacy regulations.
No, I think that's very well said, because it's, kind of implicit in what you're saying is that whatever privacy scheme you're looking at actually presents an opportunity as opposed to a stop point. It's, it gives you certain protections to be able to work within that probably to some degree allow greater comfort around what's happening, because you know that everyone's going to be working from the same baseline, and then you're allowed to grow and develop from there. Exactly.
I like to picture this opportunity to innovate. If you think about Lego blocks, right? So either you know them from childhood or perhaps your own children using them, for anyone who understands how Legos work, that's how I like to think about the opportunity to innovate in an ecosystem, right? There are these huge blocks in Lego, but they're also very small blocks for very specific purposes. And if you think about technology ecosystems in the same way as Lego blocks, you can create almost anything. You can continue to innovate, right? There's still guardrails, but you can use your imagination to create. And then the sum is greater than the whole, right? So what you create with those different blocks, it's almost always better than one big block that's laying there for both, how it's used, and function, but also in beauty and aesthetics as well. So I argue for that, and I'm a firm believer in the Lego block approach to tech ecosystem.
And I like that analogy because it's, as you said, it's you're giving components, but then you're also given the freedom to put those components together in any number of permutations, and also be able to look at it from many different directions to allow, to keep branching along different paths.
Yeah. And there's so many examples of this. Salesforce is a great company that plugs and plays their software with others. Slack is another. They're just great examples in tech that, a specific solution for a specific purpose can work well in an ecosystem of other solutions. And then all together, right, they create this amazing functionality for the user as well as for the hospital, right? So there's always, you think about it from there's a corporate user of technology, but then there's an end user, both the end user using tech who works for the hospital, but then ultimately in our case in healthcare, there's always a patient, right? The technology is touching a patient. And so you have to keep that in mind as you build these Lego blocks. And in many cases, one big block doesn't necessarily solve for all those unique needs that are present for the provider as well as the patient.
And kind of thinking about, how strategies can be developed and then rolled out. I know you were saying that kind of the experiences during the pandemic provide a lot of, I think promise in terms of what can be done. So what do you see as some of the most positive aspects of the experiences that have been gained during the course of the pandemic?
Yeah, I definitely think just all of the digital aspects. So everything from if providers didn't already have online scheduling, they do now. If they didn't have a telehealth, telemedicine option, they do now. And then from the payment side, very significant uptick in everything being paid online versus at the point of sale. And this request and high interest in contactless payment. So this combination of from the pre-service all the way to post-service, how can digital, like what we've seen and continue to see, is how can digital change things from the very, very beginning when someone's thinking about needing to see a provider all the way through paying that bill, right? And that financial experience should be just as good as the amazing clinical experience that providers have. So yeah, we've seen lots of advances. And I think I mentioned earlier this big shift to curbside. We're all used to curbside now in our personal lives for takeout and food. And you hear this term, picking up your groceries instead of going in the store. So literally that curbside shift in healthcare, we're actually seeing that. Like no more waiting room, no more clipboard, no more. We had one client who recently told me they had installed the Ring, those cameras that people put, by their front doors.
Yep.
So they're using that sort of technology to limit the human interaction, right? And the potential for spreading of infection at some of their facilities. So all sorts of creative things that have happened in this time.
Understanding that there has been a lot of creativity, have you noticed any areas where kind of the approach taken is something that you hope does not reoccur in the future?
That's such a good question. I think it goes back to how can we really think strategically and plan comprehensively? So what do I mean by that? I think because we had to react so quickly, all of us and all of our healthcare partners had to react so quickly that there wasn't more of a plan, right? And so what I think that could be improved going forward is this thought process that goes into how can innovation make the entire experience better, both for the hospital as well as the patient, instead of a piecemeal. Now we had to react, and so that's great. But really, when you think about like a comprehensive digital experience, Matt, you think about Uber, which we've all come to take for granted. And I know it's a very common example that people use, but imagine that experience. Like imagine a hospital knowing it's you. Like when the Uber car pulls up, they know it's you, right? It's a GPS on your phone. When, and you get in and you get your service and then you get out of the car and it's paid. And so, and if you leave something there, there's a way to retrieve it, right? I think that is where we need to get to. I think we had to, quickly react and do certain things. But what I'd like to see and where I think there's an opportunity is how can we plan for, invest in constant innovation, not look at innovation as a one-time major expense of one big EMR, which is very important. Don't get me wrong, because we all have to have the right backbone. But there's an opportunity to be planning and thinking about that digital experience, both for your providers, for your patients, for everyone, all the employees involved. And those, we have some customers who do think that way already, and it's really awesome to see. And I love being part of that, their journey there. But I think we have a long way to go across the board.
Yeah, and kind of as you're describing it, it's really about a perception shift. It's, as you said, you have to move away from the idea that you can make one purchase or one acquisition implementation and then the entire process is over with. As you said, it really has to be a continual reexamination and assessment of needs and opportunities, and being able to interweave all of that together. But believe it or not, we're already out of time. So I think that's a great piece of advice to leave people with. But I want to thank my guest, Julie Gerdeman, for a great conversation today.
Oh, thanks so much, Matt. I really enjoyed the time.
And thank you to everyone listening. Keep the dialogue going and connect with me at #HCDEJURE. I'm Matt Fisher. Until next time.